I came to Chicago because my husband is from Chicago. I had visited Chicago uh, earlier in life. When I was in high school, I came and got a job because there weren't many jobs in Mississippi. And I met this man after I finished high school, and he had to go to Vietnam. So I went back south. And then I returned back when he got out of Vietnam. We came and we made Chicago our home. Chicago was a very exciting time in the 60s for me and in the 70s. And there were a lot of activities. We were living in Lawndale. There were a lot of activities on the blocks. People were very friendly. They were very neighborly. They sat on their porches. And so, I really got into the culture. I had worked for several agencies on the West Side. I was very concerned about people, and I had seen the community continue to decline, even though there were a lot of programs. And, I had gone to school and got a degree from University of Illinois and then University of Chicago for my master's degree. But I was pretty frustrated with the way programs were run. It seemed to me as if the programs were run so that the organizations could benefit. And oftentimes that meant that people were seen as cases, as data, as numbers, and the relationships that basically help people to move ahead, were not there. Organizations tried, and organizations, good people at these organizations, many of them, but when the money comes for a certain thing and the people in the community say, well, that's good, but what we really need is X, Y, and Z. It's very, very hard to take the money and spend it on what the people say. You have to do what the funder says. So in that sense, people were diminished. Their views and their ideas were not appreciated, and it didn't empower the people. So the West Side Health Authority was started without money. We started it without funding. We wanted to hear what the people said. And we would basically go with what the people said. For the first year, we had no funding, neither did we solicit funding. The West Side Health Authority was started to give people a voice in shaping public policies and shaping the programs for the West Side. So many of the programs were being shaped by others outside the West Side, driven by university folks who spent 3 weeks in the community talking to a few people, but it wasn't shaped by the authentic voice of people in the community. And we felt that people needed to have an opportunity to have their voice heard, their words heard. And that's why I started the organization. We started the West Side Health Authority with a hospital. Bethany Hospital was on the verge of closing. We mobilized people to stop that closing. And that meant that we had to, make sure the doctors stayed there at the hospital. We had to get people involved from the churches so that they would actually attend the hospital because the census was down at the hospital. We got the pastors involved. And right after that, another hospital, which had closed, was up for sale. We wanted the community to buy that hospital rather than an outside investor. So we mobilized the people in the community to buy the hospital. The hospital was $2.5 million. And we were able to get the local churches to raise $80,000. And we got that match. And then we knew that we had a good coalition, people who would fight for the rest of it. And so we were able to get somebody to come in and lease the space out for 2 years for $2 million. So we were able to get that owned by people in the community. If it's owned by people in the community, we can have a voice in saying what goes there. And we were able to get a Cook County, a public institution, to come in that space and rent that space so that we would continue to have good public health care right there in our community. And then after that, we did not want to be known as the people who just did hospitals. So we asked the people, what is it that they felt we needed to do to make the health better in the community? And they said, well, I don't know about health, but I am concerned about the gunshots behind my garage on Saturday nights. And well, what are we going to do about it? And somebody said, well, you can't do anything about gunshots unless you offer these kids some jobs. And so, one-on-one, people said what they thought would help. And we put all of that together into a work plan. And we were able to get over 300 youth employment at the health centers, and hospitals where they learned health careers. And they worked in every corner of the hospitals. They worked in the gift shop. They worked in food service. They worked in hot patient care. They worked in taking books around to patients in the hospital. They were trained by Malcolm X College, who came to the schools. And, we had buses picking them up at the schools, taking them to the hospitals where they actually served as interns in that training that Malcolm X was teaching them. But so it was about 300 kids, and all the kids' grades at the school also improved. And the city of Chicago paid for it through some youth program money that they had. So the kids were able to learn, be engaged with people in the community in a productive way that could lead to a future. And they were also able to get paid. Many of them had to help their moms pay the light bill, to pay the gas bill. So it was a real benefit for the community overall. And most of the kids, I don't know all, but most of the kids ended up actually getting scholarships. Walgreens gave scholarships for them to go into pharmacy technicians. And so, they were able to, some of them went into accounting, some of them went into LPN, nurses assistants, all of those kinds of jobs. So we were excited about that. Then people said that, well, we need to do something about businesses in the neighborhoods. So we were able to begin to find the local businesses in the neighborhood and connect them with hospital contracts. So we were able to get the man who had a fish market to sell fish to Bethany Hospital on Fridays. This was the hospital we had stopped from closing. So they were anxious to work with us. We were able to get a little mom and pop paint company to go in Loretta Hospital and start off with the contract painting the kitchen. And they ended up doing a great job. So they ended up painting the whole hospital. We got the man who had MK cleaners to go in and meet with the procurement officer. He got a contract cleaning the drapes in the emergency rooms. And then he ends up cleaning the hospital floors. So, we basically generated about $3 million in new contracts for those businesses in the neighborhood. And but finally, people were saying that, we still need to do something about helping our children to understand the cultural values and norms that we have in our community. There's a lot of violence, and all you're seeing is on television is negative things about Black males and our families. And so, people on the blocks, we organized 60 blocks right around our building. And, somebody says it takes a village to raise a child, which is a very prominent saying at that time. So we said, if it takes a village to raise a child, what does it take to make a village? And so we said, if we take every block, and identify citizen leaders on that block and have them come together and organize on that block, they can help take care of each other's needs on that block. So that's what we did across 60 blocks. And we would have meetings once a month with the citizen leaders. And every meeting would have at least 2 citizen leaders, at least 2, sometimes 5, sometimes 6 from each block. And they got and built relationships with each other, trusting relationships with each other. They had potlucks. We started all kinds of rituals. They would have fall festivals and Thanksgiving potlucks and the things that people do to create a sense of community, coming together to celebrate one another. As an organization, we didn't have to report to a funder how many people showed up and how many people played and how many people got sick. This was about community and community taking care of community. When you build a building, when you create a space, it is not something just for those few people. It is something for the whole community. Our community needs to be inspired. They need to be able to see something Our young people need to be able to see something. The stories that I told you are old. So the Aspire Center will provide an opportunity to leave a legacy, to let them know and see what's possible that they themselves can do. We are Black just like them. We live in the community just like them. We are out here working without money, but we are hoping. We have hope, and we believe, and we try, and we just keep walking by faith. And that's what it takes in our community. We have to come together. We basically ask everybody to help. And we have a legacy of asking everybody to help. When we had our neighborhood village, we asked people to help us to build a wellness center. And they raised the first $60,000. The wellness center would cost $4.5 million. But they raised the first $60,000 selling catfish dinners. And that wellness center is there right now. And that wellness center is a source of pride for the community. So owning and developing your own assets in the community is important, notwithstanding the vision. The vision for that building is very important because the vision is one that talks about training our youth to be high-tech manufacturers, to work in the industries that are up and coming, not on dead-end jobs, having restaurants and having a bank, being able to access things right in your own neighborhood, creating jobs right in your own neighborhoods, and it's done by us, for us.